This is more treatment intervention related. What are the most common mistakes that parents, teachers, and even professionals make when trying to help a child with SM, and what approaches should be avoided?
I think that it's about understanding first, right? So we talk about behavioral treatment, right? To be able to help shape behaviors, cognitive behavioral treatment, which is a big piece of SCAT. SCAT is social communication anxiety treatment. And really, it's a conglomeration of evidence-based treatments. It includes behavioral and shaping their environments and modeling and so forth. But it's also very cognitive, where we help kids understand their feelings. We teach them the bridge. We help them understand how their thoughts, their feelings lead to behaviors. We help them understand, we demystify this with them so that it is that they aren't lost. So the biggest mistake is assuming this is about speaking. And here's part of the problem. The name, selective mutism, is lousy. It implies that these kids are selectively not speaking. That's what meets the eye. That's what you see. But that is that's just a symptom. The not speaking is a symptom. It's about the critical need to understand. So the biggest mistake is seeing a professional working with a school where the focus is on speaking without understanding who that individual is and what may be contributing to the development and maintenance, what's keeping it going despite treatment, and respecting their stages of communication as a way to start to move forward and to know when to bridge up, when to know to bridge down. Because it's okay sometimes to bridge down in a setting that may be very overwhelming, or when someone senses, or when that individual senses a high expectation with someone they're very conditioned with, and understanding what strategies may work best to help move them. So the biggest mistake is focusing on talking when that child is not ready to talk, but they're working on other strategies and interventions to build comfort, to build connection, to increase confidence, which leads to the fuel to communication progression as we educate parents. Another big mistake is thinking you can go to a therapist, send your child back every single week, and not work with the parent. The parents need education and tools. Another big mistake is the lack of accountable, concrete goals for parents, written goals to help them unlearn their conditioned behaviors that may be enabling their child's lack of progress. And the lack of concrete, accountable, written games for young children and goals for the teens or adults. They need those written concrete. Now, look, we make it fun. Sandwich question, action plans, common questions, I Spy games, Mr. and Mrs. Handover for little guys. There's a million games, the I am, I just statements. There's the interview games that are broken down into 50,000 different types. The point I'm making is all of these activities and strategies are integrated into a treatment plan. We need to set the world up. Another problem is IEPs, 504s, giving them rewards for speaking when they're not yet ready. Does this mean, am I implying that you never talk about talking? Absolutely not. We talk about talking all the time, but the child has to be ready for it. And once you help them understand, acknowledge the challenge and feeling comfortable using words, talking about it in that way rather than you need to, you should talk. And we teach those children how to understand themselves, respecting their feelings, 0 to 3 for little guys, 0 to 5 for older folks, and helping them rate and grade their feelings in various situations. It really does help demystify this and deals with that pink elephant in the room. So the family that says to us, are you going to talk about this with my child? My answer back is, we're not going to go up to them in the weight room and say, hey, you're here for selective mutism and we're going to do whatever we can to get you to talk. We help build comfort. We connect with them. We find their strengths and use those big shot roles to increase their confidence. We give them we work through strategies to build that confidence so they see what's happening, and we help them understand the bridge. Kids as young as 3 can make a bridge. It's crazy to see how when they understand this, when they understand their games and they're playing their games and they're getting rewards for game playing, a byproduct is communication progression. A byproduct is comfort, connection, and confidence building. It's amazing to see all that. So the biggest mistake is thinking selective mutism is all about speaking and not. It's a social communication anxiety disorder, and it's about really understanding that person and then developing the treatment plan for them and the school-based accommodations interventions, and training parents and training school professionals and training educators in a way that they know how to help them in the classroom, because that's where kids spend so much of their time. Another mistake is thinking treatment in an office alone is enough, that they will then on their own go out and do it. Can't be anything further from the truth. And this is why, at least at our program at Communicamp, all day parent education to connect that social identity with parents, but us to train those parents in ways that they have those tools so that when they walk out of that camp every afternoon and after camp, they have so much in their toolbox because we can't go with them. So it's about training. If you're in individual care, it's about learning what your child can do in care and then translating that back to the parents and translating that back to schools and teaching and educating schools. So the biggest mistake is thinking therapy alone is enough. It's not. It's the accountable, concrete games and goals that those kids play, the concrete, accountable goals and written goals that parents do, and the goals that teachers do, the strategies that we teach them, the interventions that aren't hard once they understand, because it's what they do every day, but it's how they question, when they question, where they question, and with who they question. So small groups are great. Buddies are fabulous. But what are you doing in those situations? How are you questioning? I think I said a lot, but I think it was hopefully a way for our listeners to understand you can't just treat to speak. It doesn't work. And you can talk
Yeah,
about
that's the
talking.
key.
Yeah. And you can talk about talking, but you need to meet that child where they're at. I have so many kids that are verbal, but they're working on initiation, elaboration, expression, conversation starters, I just statements to expand conversation. We're working on all that.
Yeah, and I guess just to go back to the question at hand, what approaches should be avoided? I would assume you would agree that, saying something like if you talk, you'll get a reward or something like that, like really making it about talking. I think
I
that
think
I would
that
assume you would.
I think, yes, you're right with that understanding. However, I have plenty of kids in our practice that we are talking about talking, and they are getting rewards for adding people to their talking club, or we are working on more spontaneous elaboration and expression, but they're
That
ready
makes
for
sense.
it, Brandon. It's about knowing who that
Right.
child or teen or adult is and meeting them where they're at first. And if you have a child, or if have a, obviously a teen is a child, and that child is avoidant, is more anxious with the strategies and the interventions being utilized, you need to step back and go, whoa, I need to figure this out, because your child shouldn't be. So for the parents listening, your child should be doing this in an upbeat, positive way and starting to really understand this so that they can build those long-term coping skills.
Yeah. Okay.
And that's one of the beauties we see, in individual care and Communicamp, is these kids are like in camp, they're around other kids that get it. They see that they're not alone, and they're working on strategies and seeing their progression. And that is just so amazing and so empowering for them. And that community is so empowering. And it's about finding that community for parents and kids through Facebook groups, through intensive programs, through support groups. It's very, very important.